everyone, my name is Sarah. I am one of the ketogenic dietitians at the Children's Hospital of Philadelphia. I've been there for about 10 years now and have specialized in keto for the last 9-ish years. So it's been some time. So I'm excited today to talk about the ketogenic diet. Okay, so basically for today, we're just going to focus on a little bit of the history of how the keto diet came about. What exactly is the keto diet? Focus on macronutrients, indications for keto, efficacy, kind of review sample meals if your child is tube fed, and then my colleague Liza here will more focus on the culinary approach to the ketogenic diet. And if you have questions while I am talking, I'm happy to take them. Okay. So fasting was first recognized in biblical times as a treatment for seizures. There was a man who had episodes that seemed like seizures, and they found that with him fasting, they disappeared. And then, of course, in the early 20th century, it was noted that fasting causes ketosis, and also found that a diet low in carbohydrate and high in fat also induces ketosis. So, of course, based on these findings, Dr. Wilder of the Mayo Clinic proposed that the benefits of fasting could be attained if ketonemia was produced by other means. So he was the one that designed a high-fat diet that mimicked fasting, and that is the ketogenic diet that we know of as today. Okay, so what exactly is the keto diet? So it is a very high-fat diet that is low in carb, but also provides adequate protein. So basically, the goal is to deprive the body of carbohydrates to induce ketosis. So instead of your body using glucose as its primary fuel source, your body is now using fat as its primary fuel source. So fat is what's breaking down into ketones, and that is what's giving the anti-epileptic effect for patients with epilepsy. Okay, so what exactly does ketosis mean? So the clinical definition is a beta-hydroxybutyrate greater than 1.5 millimole per liter. So of course, in keto, we can see various numbers of this. In general, we would say for most patients, 3 to 4 is typical. You see good seizure control with that. Ketones can be measured in the blood and urine, and then the body's primary source of fuel is now from fat and not carbohydrates. So that is what ketosis means. Okay, so now we're going to focus on the macronutrients. So there are 3 macronutrients: carbohydrates, protein, and dietary fat. So carbohydrates, those are our body's main source of fuel energy. So when we think of carbohydrates, we think of fruits, we think of vegetables, grains like rice, pasta, and bread. Our second macronutrient is protein. Protein's important because they're the building blocks of muscles, bones, cartilage, and skin. Important in growth and development, especially in kids. It helps bodies repair cells. When we think of protein, we think of like chicken, beef, eggs, dairy, fish, shellfish, soy. Those are our protein sources. And then that brings us to dietary fat. So dietary fat provides essential fatty acids, but also helps the body absorb vitamins. It provides a very concentrated source of energy. So unlike carbs and protein, which provide 4 calories for every 1 gram, fat provides 9 calories for every 1 gram. And when we think of fat, we think of butter, mayo, oil, and heavy cream. Okay. So breakdown of keto. So what is the nutritional profile? So what exactly is a ketogenic diet ratio? So it is the proportion of fat to the proportion of protein and carbs combined. So basically, the higher the fat, the higher the ratio of the diet. I'm sure if you've heard of like a 4-to-1 keto ratio, that means that 90% of your total calories are coming from fat. And then the other 10% is your carbs and your protein. Okay, so you think like on the highest ratio, your total carb intake is no more than 10 to 15 grams of carbs per day. So if you want to look at that in food, what does that exactly mean? So for example, if you're at like a 4-to-1 ratio and you're limited to 10 grams of carbs per day, that would be equivalent to either like 100 Cheerios, one slice of bread, or like 10 to 12 grapes. So you can see how low of a carb diet it is. Of course, on the diet, calories and protein is not unlimited. We do control for the calories, but we control it so we want to allow appropriate growth and weight gain in our population. Protein is limited, but we do try to meet age-appropriate needs for growth. And then, of course, vitamin and mineral supplements are very important on the diet. So a diet very high in fat lacks in many vitamins and minerals because the majority of our vitamins and minerals come from our carb sources, come from our protein sources. So it's very important that all our children are supplemented. And then, of course, your supplement needs are based on your age. And then, of course, depending on lab values too as well. So let's, for example, vitamin D is a common one. Most kids are low in vitamin D, so typically need more than the recommended amount to have a normal level. Okay. And these pie charts are really more of a comparison I like to show of like how drastic this shift is from our standard diet going to a keto diet, or something if you've heard of a modified keto diet, which is supposed to be somewhat less restrictive than true classical keto. So on our standard diet, like you and I would normally eat, like 50 to 60% of our total calories are coming from carbohydrates. So those are our fruits, our vegetables, our grains. 25% of our calories are coming from fat, and then about 15% of our calories are coming from protein. Now, if we shift that to the 4-to-1 keto diet, more than 90% of our calories are coming from fat. And then carb goes from 60 to almost like 3%. And then protein is not terrible, but it's still only about 7% of your total intake. And then something on like a modified version of the diet, which is still technically very high fat. Your fat intake is around like 80% of total calories. You do get a little more protein, closer to what you would get on a typical American diet, so like maybe like 13%, and then maybe a little more leeway in carbs, and that is you get about 5% of your total calories coming from carbohydrates. Okay. I like to put this in here because I do feel like I get this question a lot if medical keto is a weight loss diet, and I get both ends of it. Like, is my child going to lose weight on keto? Is my child going to gain too much weight on keto because they're thinking they're only eating fat? And the answer is no. Because we don't expect that, because the kids are burning the fat as fuel. So we do not expect them to gain excess fat. We expect them to grow appropriately. We want them to grow for their age and their activity level. Okay, which brings me to, so who should keto be offered to? So all intractable epilepsy patients, so patients who've failed multiple medications, all seizure types, epilepsy syndromes, different etiologies, and then all ages. We offer keto from infancy all through adults. Recently, we've even started premature infants at like 34 weeks on the ketogenic diet. Another reason would be if they had poor tolerance to anti-seizure medications, or they had poor side effects. And sometimes, like if patients do respond to keto, there is a chance that they can reduce the number of medications they need to be on, or even possibly reduce all anti-seizure medications. And then we have, in general, about 20 to 60% of responders are treated eventually with keto only. Okay, and then some absolute indications for keto, and this is for kids with inborn errors in metabolism, so defects in carbohydrate metabolism where they can't properly utilize glucose for energy, and that would be PDH deficiency and GLUT1 transporter deficiency. Okay, so efficacy of the diet. So in general, about 50 to 70% of all children on keto have about 50% of reduction in seizures. So like a decreased frequency, duration, strength. About maybe 25% become seizure-free. And then now, if they possibly don't see the benefits of the seizure reduction, we do have some families or patients that see improved alertness, improved cognition. And so for some families, that's enough for them to stay on the diet. You know, I've had parents tell me, like, they might not see the seizures improve, but then they say, I feel like my child is awake again. You know, they are making eye contact, they are smiling at me. And for some families, that's enough. Okay, so on a classical keto diet, all the foods are weighed on a gram scale. So we weigh everything to the 10th of a gram. It's very strict. The carbs and protein are limited, and then of course the fat is the main part of the meal. We personalize all our meal plans for every patient. So no two patients will have the exact same meal plan. Everyone gets a prescribed amount of calories, and then that gets adjusted based on their growth. It's obviously, and of course we update this as the patient grows. And you know, of course, we never want a child to feel like they're hungry. If they're telling us they're hungry, we're increasing the calories. If they're telling us, oh, this is way too much food, I cannot finish all this, we're gonna reduce the amount of food that we're giving them. Okay, and then I think another version of the diet that we do also offer is called the modified ketogenic diet, or sometimes also referred to as the modified Atkins diet. Still, again, very high fat, low carb diet with limited protein. But on this version of the diet, you use household measurements. So instead of weighing everything on the 10th of a gram on the scale, you can use like things like cups, teaspoons, tablespoons, and things like that. And one of the bigger differences is that classical diet, we count total carbs. Modified diet, we count net carbs. Net carbs means that you can subtract fiber from your total carb. So in essence, you might get a little bit more leeway with how much carb you get within a day, but it can vary more. It's not as consistent as a classical keto diet. And then of course, you know, nowadays there's a lot of commercially available products on the market that go keto, and they have a lot of high fiber. They have quite a bit of fiber added to them. So those can be utilized on the diet. However, we do encourage our families to limit those because we have seen that the more you use those products, the less likely you're going to be producing ketones. Okay, and I think I focused on this, like, diet can be offered for all age ranges, infancy through adulthood. We start infants, so infants start with formula, then they transition to purees, they transition to table foods, and we walk them through that entire process. You know, then we have kids that are toddlers, children, teenagers that we start on the diet. So, you know, some of them food by mouth, some of them formula by mouth. We do formula, we do blenderized food via feeding tube, you know, and then of course a variety of textures depending on the child's developmental stage. And as for enteral nutrition, so if your child is tube fed, of course the nutritional needs, so the calories, the protein, the carb, still calculated, the ratio calculated in the same manner as someone that would eat orally by mouth. We can use blenderized tube feed, so meaning you're going to be using real food to create keto-friendly tube feedings. So like you're just going to be blending up like oil, I don't know, chicken and carrots. Blend it all up, and then you're going to be giving that through the tube. And of course, we have commercially available keto formula that we can use. And there's a variety of formulas that we can use. There's whey-based formulas. There's pea protein-based formulas. So maybe if you have a dairy allergy. And then, of course, we have like peptide-based formulas if we have children with more GI intolerance or things like that. So more of a discussion that is had based on like what they're currently on and what you're looking for your child too at the same time. And honestly, in the last 15 years, we've come a long way, because I think like 15 years ago, there was like one keto formula available, and it was a whey-based formula. So we didn't have the option of the pea protein. We didn't have this hypoallergenic formulas. So we had to create our own formula concoction that we use for a lot of our patients to meet the nutritional needs. So a lot has come in 15 years, and it is amazing. So the next couple of slides, I just like to put in like pictures of what the food or the meal can look like. And of course, this is not like something what every child would eat. purely examples. It just shows the drastic shift in proportion of what a meal might look like. So these are both going to be 3-to-1 meals at 400 calories. So you can see how on keto, because we talked about fat is so calorically dense, the volume is always going to look much smaller for the same amount of calories. So here for a meal, we have eggs and bacon. So our fat sources are going to be our heavy cream, our butter, and our oil. So about 1.5 ounces of heavy cream. We have about a tablespoon of butter, and then we have about a teaspoon of oil, and these are our fat sources. Our protein sources here are the scrambled egg and the bacon, and then so you get maybe about 2.5 tablespoons worth of bacon, and then about 2.5 tablespoons of egg, and then about a slice of bacon. And to visualize what it looks like, you can kind of think about for every 5 grams is approximately a teaspoon of something. It's not exact, but at least visually it can help you see that, like, oh, how much food is it going to actually be once I calculate it out and like weigh out that amount of food. And then here for our carbs are strawberries, and so we get about 1.5 tablespoons worth of strawberries. And then another meal, this is my keto charcuterie board, I like to call it, and it's pepperoni and cheese. So again, our fat here is the heavy cream, which is still about 1.5 ounce. And then we have here about 1.5 teaspoons of oil. And you can see here, it actually looks like a little bit less fat than in the previous picture. And that's because, you know, pepperoni is higher in fat. So sometimes if you have protein sources that are higher in fat, it helps take away some of the actual added fat, like whether the mayo, the butter, or the heavy cream that you have to eat with that meal. The protein here is going to be the pepperoni and cheddar cheese. So you get about 11 slices of pepperoni and a 3/4 slice of a cheese. And then our carbs here are the cantaloupe and the cucumber. So about 1 small piece of cantaloupe and then about 5 pieces of a cucumber. So these are just some examples of like what a keto meal might look like, what a child might eat. And, you know, of course we teach our families like, where are you going to put the oil? Where are you going to put the butter? Like, so oil emulsifies really well into heavy cream. So we a lot of times encourage our families to make shakes that way. You know, of course the butter we would mix into the scrambled eggs on the previous picture or something like that. You can cook heavy cream into the scrambled eggs. So while we can do all that, that being said, I have plenty of children that love to syringe oil and eat butter straight. So it's really personal preference and what your child likes and what they want. Okay, and that brings me to my portion of the talk.
I'm just curious, and I don't know the answer to this question, but ketoacidosis is kind of a common concern.
Yeah.
Is that applicable in epilepsy? And what is the link?
Yeah. So I didn't focus on side effects in this talk, but yeah, that's a great question. So this is why for us, we actually admit all our kids to the hospital to start the classical version of the diet, because acidosis is actually a big concern when starting the diet, because ketones are acids, so your body can become acidic. But we offset that by giving a medication that would basically equalizes the blood out so that they're stable, they're neutral. So, but you know, in the beginning, unfortunately, it depends on, like, we always start our kids prophylactically on it before we start the diet, the medication. It's like a citrate medication, it's like a buffer, bicarbonate, it's like a buffer. But unfortunately, depending on how quickly the kids go into ketosis, some unfortunately can become rather acidotic even though we've started the medication, which just means that they need more of the medication.
So my daughter is in the keto diet since she was 9 months old, I believe, and as mom, something that I found like the first months is very easy, really, because you use purees and it's super easy to weigh everything, because everything is mixed. So in 1 spoon she's having the right proportion of everything. However, as she grows up, the challenge increases, right? Because you want her to start chewing, because that's important for helping her in case she eventually will speak and these type of things. and that's a challenge.
Yeah.
Because when they eat a piece of chicken, they are not eating the right fat for that amount. You know what I mean? So that was a big challenge for me. But eventually, something I found out, and I don't know if this is general, but the younger she is, the more complicated it is to produce ketosis.
The keto?
The keto, sorry. But as she grows, she doesn't need to eat that much fat to produce them. So it's easier with age.
Yeah.
I think she produces those like more easily.
Uh-huh.
And I don't know if it's just my daughter or this is general.
I can't speak because I don't know like her exact circumstances of like where she started on the diet, how they progress with her. I will say in general, we do see for our young children that they can produce ketones rather quickly. So sometimes, no, when they're like little. Yeah, usually like our older kids, so let's say our teenagers, it takes them longer to convert it to producing ketones than our like younger kids.
But then that's not
But again, I don't know her specific situation. I'm just like generally I'm talking of like what we typically see.
It is challenging. As I said at the beginning, like when she's a baby, it's much easier. But then keeping the keto diet consistent throughout the years.
Of course, yeah.
Like to be honest, right now we are super easy. Before I was weighing every gram.
Yeah.
Everything mattered. But right now it's you want your daughter to eat.
Yeah, of course,
So
yeah.
You cannot be that strict
Nope.
as you were when she was
Yeah, and that's what we focus. Like we want to we still want them to develop those proper eating skills, and we don't want it to turn mealtime into like this like you have to eat this, you have to force mealtime because we know that's not going to be good for them too. So I always encourage my families to be like, this is the meal. We know food's going to fall on the floor. We know food's going to fall out of the mouth. But in general, if they're like for the most part getting the majority of their meal, we're happy with that. Now, of course, there's going to be different situations of like what's going on if like you're so worried that they're only focused on eating like just the carb and they refuse everything else. That's obviously a different like clinical scenario. But like, then focusing maybe on like working on doing all-inclusive meals in the beginning too is going to be helpful too. We have a lot of recipes where we use a lot all-inclusive meals to help our families trying to transition too at the same time. Yeah, but we do tell them a lot of times, like I always tell my families, like, because we do always say, we push so hard, like, this is your medicine, right? Like, this is your medicine. And I think we sometimes like stress families out, like they have to eat every single drop. And no, like you feed her and let her eat what she wants. She is still a kid. She is still a toddler. Like toddlers are not like regimented, like I'm gonna eat every single thing, So I think the focus is she's a child first too. And then we kind of figure out the next steps of how else can we work that situation.
And also something that I experienced was that at the beginning, it was like a drop. Really, it worked really well with my daughter. But as every single treatment, it works while it works. And then at some point, it stops working, right? But we also noticed that if we were too flexible, the seizures increased again. So there's a clear relation.
Yeah.
So that's why we still keep her in the keto diet, but to be honest, like the ratio is not as it used to be, not at all.
And I've seen too, like every child is so different. Like I have kids, like I have many kids that, not many, but I have some children that do, I want to quote unquote say cheat, but they are like, they grab something like, and it's like, it breaks your heart too, because sometimes like I've had families saying like she just grabbed an apple and ate the apple, and like it hurts because like I totally get it. Like you just want them to be able to eat the apple, but every child, like that child, it didn't affect that child. But then I have a child that eats one tiny extra bite of carb, and then unfortunately they see an increase in seizures because they need their ketone levels much higher than another child. It's hard. Yeah, I understand that. Yeah, it's tough. And it's not an easy diet. I mean, I wish this diet on no one. I really do. It's not an easy diet. I mean, I love to see it help our family so much, but I also understand like the struggle and how difficult it is to implement at home too.
The way that I see it, like as a mom again, because she eats 5 times a day and then it's like every single day. Yeah. I don't think this is going. I don't see it feasible that it's going to be sustained with the years.
Yeah.
But like lessons learned. you also know that you cannot feed her sugar. Like sugar is like the
Yeah.
devil.
Yeah.
That's not
Yeah,
gonna
we
happen.
have,
And then
like-
carbs lower the amount
can
and
always
play
do-
a little with the rest.
Yeah, like lower glycemic index carbs, you focus on those type of things, and you just don't add in like, the cakes, the cookies, and all the things like that type of thing too, yeah.
I was just going to ask again for my own not understanding of it, but how important is timing in which like calories are delivered, like evenly distributed throughout the day or at certain time points of like a person's circadian?
Yeah, no, it's really just dependent on that child. So like, I mean, obviously we eat as we typically would, like breakfast, lunch, dinner, snacks in between. It's just variable. So like, some kids like to eat 3 meals a day. Some kids per like 3 meals, 3 snacks, or 4 equal meals. Like it just varies on the child and what they're looking forward to. And most kids, I mean, we don't encourage skipping meals by any means, but like if your first meal's at like 10 a.m., that's okay too.
And then I think the dietitians also usually say that if you are eating a prescribed meal plan, that like say within an hour or 45 minutes or so, you don't want to stretch a meal out for hours because you kind of want to be getting the correct ratio of macronutrients sort of within the time, within.
So you're not saving like your breakfast carbs for dinner. So like every meal and every snack should be that ratio you're prescribed, and you should eat it within a normal like meal time frame type of thing.
And also in terms of efficacy, have you noticed that, for example, starting as babies, the efficacy is higher than if a kid starts with this diet when they are teenagers, for example?
Not necessarily, yeah, no. I think it just varies on the clinical situation and like what the child has and what type of epilepsy they have, yeah.
I think it's a challenge more like if you are 13 years old and you're used to eating in a certain way, then changing that. Like,
I will say when we start our teenagers, it is much more challenging because, you have to think about the social aspect of eating too, and they want to eat like what their friends are eating too. So it is much difficult. And we do actually, for them, in general, depending on the child, we more so encourage the modified version of the diet because it can be somewhat less restrictive, slightly more liberal for them. It might be more easier for them to maintain versus the classical version of the diet, But it is really hard for teenagers,
We're just having a little technical issue with the signal seems to have been lost, so apologies, but hopefully they'll figure that out soon. And I will talk a little bit more about what you were speaking to of the difficulty of when you're not making just a puree where everything is pre-mixed. That's sort of my role as a medical chef at the same program at Children's Hospital.
Liza's amazing. She just makes wonderful recipes.
that's great. Because our kids, for example, and I'm not talking just as the mother of Claudia, I'm talking like a lot of moms share the same challenges. And for some reason that we don't understand, especially when they are younger, like 0 to 2 or 0 to 3, there are different periods in life that they decide not to eat. Like they shut their mouth for 5 days in a row, and then it is.
It's difficult and it's like stressful.
In the hospital, because of course after 4 days not eating anything, you are like, Anyway, so
No drinking either.
sorry.
No drinking, like won't drink fluids.
Sometimes,
Sometimes, depending on what's going on, So that makes it even more difficult too, because then they really don't feel great especially if they're not drinking and they're not even minimally able to take in their carbohydrates. Because we do run into the issue sometimes, like kids. Obviously, we know they're kids; they're going to get sick too. So we have like sick day diets. We like to call them, where we just like let them just eat the carb portion of their meal or just the carb and protein portion of the meal, and we tell them you don't eat the fat. Don't eat the fat. Like, fat can take a long time to get back in the diet. They're not going to fall out of ketosis by not eating the fat because it's going to be so low in calories. It's almost like mimicking fasting type of thing too. So that's not usually a concern. But so we always try to like find ways to like get them through the illness. But unfortunately, depending on the situation, hospital, depending on, obviously the clinical situation, like they end up there, We do our best to try not to, though.
But it's funny because I see this more often. The younger they are, the more often this happens. And as they grow a bit older, those episodes tend to disappear or to happen like more?
I think it's like the age of the toddler time too, so like young kids, it's hard.
My name is Liza Miller. I'm the medical chef educator. I work at the Children's Hospital of Philadelphia on the same team that focuses on the ketogenic patients with Sarah and the rest of our team. So my role really is to help educate families, parents, caregivers, and older children, when we do have older patients, on how to make this diet work on a sort of practical level. So I'm a resource for the culinary side of things, how to do the cooking. We have a dedicated kitchen there where we can give cooking classes. Because it is such a challenging diet, often people need, depending on their family's eating habits and the age of their child, need some help in sort of strategizing, what can I feed my child? There are often other children in the household, other people on different diets, and so this is a diet that requires a lot of time and effort for the food preparation. So we just try to be a resource to help make that a little bit easier for the families. So these are photos of actual ketogenic food recipes that we have made. Some of it is, I've been at the program about a year. Some of them are my dishes. We had a previous chef who was with us for many years previous to my role there, and she created lots and lots of amazing recipes. So these are all real ketogenic foods. Because we're dealing with a pediatric population, obviously you want the food to look good. You're trying to mimic and replicate some of the ways that typical kids' food looks, which is challenging, but it is doable. So we're also a resource. You saw Sarah's photo of like the meal with all of the separate components just as a sample. One of the things I do is try to like make more complex recipes, because it's easy enough for most families to put together a plate with the separate components, and that's great if that works for your child. Sometimes a child will not sort of willingly eat that extra fat. So one of the things that we try to educate people on is how to incorporate the fat into the meals, because as you were talking about, that is something challenging. But we here have like a birthday cupcake. We have something that's sort of a take on a peanut butter cup, a chicken Caesar salad, some dumplings that are wrapped in cabbage and with a mayonnaise-based and oil-based dipping sauce instead of wrapped in a carbohydrate-heavy rice or wheat wrapper. So keto food, as I say, is different but can still taste great. As Sarah mentioned, because every gram of fat has 9 calories versus 4 calories for protein and carbohydrates, it is much denser. So it does have a different, as a chef, we talk about like mouthfeel. It does have a different mouthfeel. It's richer. When you have a cracker that's like a keto cracker, it doesn't have that light, airy, crispy texture that something that's just made with like rice and salt and no fat would have, like a rice cracker. It has a richer feel. Sometimes we talk about umami flavor. That is kind of related to that as well, the way I see it. But that is something that can be considered like a desirable quality for food, is umami and richness. So it's not bad, it's just different. And also, one thing, as I just mentioned, because fat is soft, it is challenging sometimes to replicate some of the crunchier foods that we do like to eat. Because we think about fried food being crispy, however, you're frying either a carbohydrate or a protein in oil or in some kind of fat source to make it crispy. What you're making crispy is the carbohydrate, and the fat can do that, but you can't like fry oil. You know what I'm saying? So that's why some of the crispiness can be a little bit challenging, but we do our best to replicate the crispy texture as much as possible. And so, as Sarah mentioned, this diet can accommodate a wide range of textures and different types of eaters. So whether you're dealing with infants or children who are only eating pureed food or blenderized food through a feeding tube, there are lots of this diet can be fulfilled with any texture. So that's what's nice about it. And sometimes it is even less challenging, as you mentioned, with the purees and things like that, because it's easy to incorporate oil or mayonnaise or cream into like a shake or a formula or a feeding tube blenderized recipe. One other way that we try to bring in textures because of the lack of crunchiness of some things is that you can bring in crunchiness with raw water heavy vegetables like lettuce,
cucumbers. Those are all considered carbohydrates and contain carbohydrates, but they're lower in carbohydrates than, say, a starchy vegetable like a sweet potato or corn. So that is a way, if your child really likes crunchy things, to be able to like have that texture. With like iceberg lettuce, for example, is extremely low in carbohydrates, so you would get a larger portion, a larger volume of that than a starchier vegetable. And then also frozen treats, so fat does freeze pretty well, so we have a lot of recipes for like ketogenic ice creams or butter candies, things like that. That can just be something that provides variety and a little bit of different texture on the diet. So there are a lot of specialty ingredients that we do use. These are not things you have to buy. These are just products that are out there that are keto friendly. And we're not talking about the type of things that products that Sarah mentioned that are like the high fiber, zero net carb. These are actually products that are like specialty fat products. We often use almond flour because wheat flour is obviously so high in carbohydrates. Most of our baked goods, we find that almond flour is a good source, or other nut flours, though we can find other substitutes if someone has a nut allergy. There's coconut flour, wheat gluten flour that has to be blended with other things. So there are options for that. There are artificial and sort of natural non-caloric sweeteners like stevia and monk fruit. Erythritol is something that we can use in limited quantities. Then some sugar-free products, a few lines of products that are just add a little bit of variety and are nice to be able for the keto kids to be able to use to add flavor, or just have some options like for sugar-free ketchup or things like that. And also, I just want to mention, too, there are a large variety of oils. Sarah touched on that a little bit, but we talked about heart-healthy oils. Avocado oil is very popular right now, extra virgin olive oil. Even though we use mayonnaise is great for a lot of recipes because it bakes well. It's already an emulsified product, which makes it easier to use in some recipes. But you can buy avocado oil-based mayonnaise. You can buy vegan mayonnaise. So there are all sorts of, there's coconut oil. There are specialty oils like toasted sesame oil, flaxseed oil. There are lots of different fat sources, and people can sort of choose what works best for them and their eating habits. This is not a recipe for you to use. This is just a sample of a recipe, like that Sarah mentioned earlier as well. That's if your child does eat by a feeding tube. This shows you if you were not using a formula and you wanted to have a proper ketogenic classical ratio diet with whole foods, real foods. You would have to measure out exactly the gram amounts of, some fresh chicken, some fresh carrots you could cook yourself, some salt, and the oil, and it would be blended in a certain way. That is something that can be made in a batch, and if you follow proper techniques for weighing it out and proportioning it so everything is the right amounts for each meal, that's something that works well. And you can use any kind of protein that would blend up pretty well. You could use any kind of vegetable, even cooked fruits, things like that, if you want to provide that sort of like whole food nutrition on the diet. This is an example for oral eaters of sort of what a keto dessert might look like. Obviously, we're not using sugar, we're not using wheat flour. We're using a little bit of avocado and cocoa powder as the carbohydrate. That helps give it like a texture, a sort of fudgier, moist texture. Almond flour, a lot of melted butter, a little bit of egg, and then some artificial sweeteners that we use. So there are products like extracts and things like that. Vanilla extract, that's a natural product we can use on the diet. And it is, a lot of keto recipes obviously have a higher amount of fat, but that works well because baked goods tend to have, desserts have a high amount of fat. You can make an icing out of butter and heavy whipped cream, or coconut oil and an artificial sweetener and some whipped cream cheese. There are lots of ways to like add extra fat in that I'll speak about in a minute or so, or right now. So these are some of the fat hiding tricks that we spoke about a little bit, that like Sarah talked about, mixing mayonnaise or butter or heavy cream into eggs. There are certain strategies that, like if your child eats eggs, that's great. If your child will drink heavy cream, that's great, because canola oil or a neutral flavored oil can be whisked into either yogurt or heavy cream. We sometimes use this little utensil called a milk frother. It's the kind of thing you would use when you're making a cappuccino to froth your milk for your morning beverage. And that can just sort of easily emulsify oil into things. And a lot of times you wouldn't even notice it was there, which is nice. One thing you could do also is to make like a smoothie, but there are ways to sort of make these things more appealing to kids. People like to go to Starbucks and they like to get their boba tea and their fruit smoothies. So those are all types of recipes for kids that can be made like into a ketogenic recipe, because you can use heavy cream. You can sort of stick some oil in there. You could use coconut oil or like coconut cream, which is the fat part of the coconut milk. So there are lots of options there, and then you would have a small amount of, say, fruit to give flavoring. So you may need to use like an extract or sugar-free syrup to add extra flavoring if you need. But there are lots of options for those types of smoothie, sweet drinks. And then for the more savory meals, we talked about, or Sarah mentioned, all-inclusive meals where everything, all the fat and the protein and the carbohydrates are in the one recipe. Some examples of that would be like a cream-based soup. In the bottom there, that's a loaded baked potato soup that I made that has bacon and some cheese on top and heavy cream and butter. And I used a very small amount of potato and scallion, but you could use like cauliflower rice to make it instead of potato. If you want to, you would get a larger volume of cauliflower than you would for potato because it's lower in carbohydrate. You could make olive oil-based pestos and vinaigrettes for salads. So I mentioned that iceberg lettuce, romaine lettuce, you would get a larger volume of that, of course, depending on the child's age and calories on their meal plan. But you can get, if you have a decently sized pile of lettuce, you can fit a lot of salad dressing on that, which is mostly fat. So those are just some creative ways to get some fat in. And then there are also, of course, dips and sauces, which can be made with butter and mayonnaise. And if you have a child, if somebody will be willing to eat the dip with the other parts of their meal. And then this is my last slide. I just some other tips for keto cooking. I really personally feel that flavor is extremely important, and fat is pretty bland, right? Fat, even if you're using like an extra virgin olive oil, okay, maybe that's a little bit less bland, but I think it's really key and important to bring flavor into this diet, because your children are eating, or anyone on a classical ketogenic diet is eating so much fat, and the rest of your meal is small. You have to make that very flavorful to just sort of like keep things interesting, encourage, variety of foods and flavors. And so boredom doesn't, they don't get in a food rut and then not want to eat their food, because the food is the medicine, as Sarah said. So one of the ways to bring in extra flavor is to use dried herbs and spices. In our program, we do say that dried herbs and spices are considered like free ingredients because you're using very little, and they're not, we just don't really count that. And then natural flavor extracts like vanilla or almond extract, things like that, have no added carbohydrates. You have to make sure that they're not using spice mixes that have sugar and things added, like a taco mix, but there are things where it's like individual ingredients like cinnamon, garlic powder, onion powder. If you're just using a sprinkling, those are fine. I also use fresh garlic, fresh lemon juice and things. Sometimes fresh garlic is really just much better tasting in a recipe than garlic powder. And we calculate the number of carbs, but it's going to be very minimal. So to use a third of a clove of fresh garlic, you may get a lot of like return on flavor in the recipe. You still have to calculate that as a carbohydrate, but it's very minimal. So it's not going to really reduce the amount of vegetable or other, other carbohydrates in that recipe. It'll just reduce it by a very small amount, but it's often worth it. Another way to bring in flavor is to balance things with acidity. So if you think about the four main flavors, we talk about sweet, salty, acid, and bitterness. And then there's the idea of the fifth flavor, which is umami, which is that rich mouthfeel or savory. flavor. So we have, salt is generally, we've seasoned things with most of our recipes with salt, but acidity I think is an underused flavor, and that can really add like brightness to especially a high fat recipe. Sometimes they say like a little squeeze of lemon will lighten the dish. If you think about a very heavy buttery sauce, for example, that you might be eating with seafood, you think about a squeeze of lemon with that, it kind of balances out some shrimp with like a heavy buttery sauce, and you add lemon, it makes it more balanced and bright flavored. So we encourage the use of like lemon juice. Vinegars are extremely low in carbohydrates unless you're using like a balsamic vinegar, has a little bit too much sugar. And then one thing I also want to mention is that many keto foods freeze well, but when you're reheating them, you do have to be careful because they are so high in fat that the fat can sort of like melt out of the food. So we always encourage for the recipes that we develop, reheating, not maybe in the microwave, but more just like gently reheating in the oven, just to try to keep that emulsion of fat in the recipe. And also to cool, if you're making a baked good, for example, like a ketogenic blueberry muffin, we have a recipe for that. You will see sort of the butter leaching out during the baking, but then when you cool it in the pan, the butter will sort of reabsorb into it. So we often make things in like individual like muffin pans or silicone molds, because you don't want, if you make something, picture like a muffin that you were just cooking on a tray, some of the fat, or another type of recipe, some of the fat would sort of like leach out onto the tray, and then if it was not in an enclosed container, you would sort of lose that fat. And it's important that all of the fat that you've accounted for and measured for that recipe is then consumed. So we try to like sometimes cook in individual baking dishes so that everything gets eaten and served and accounted for. So those are just some of my ideas about ketogenic cooking. I'm happy to take any questions that anyone might have.
Thank you so much. I don't have a question, but I was smiling because you pictured my life for 2 years. I cooked everything. But it works. It is true that it works. When you make it attractive and appealing for her, it's easier. Like
Yes.
the keto muffins, like the keto bread, or that makes it easier to always keep the balance.
Yeah, and look, every child is different. Kids, just like adults, kids have, depending on their age too, have a wide, variety of different tastes and different, some kids are very picky, some kids are not picky, some kids won't want to eat the same exact thing every day, and as long as they're following their meal plan and getting their nutritional needs met, that's fine, and some kids want to try something new all the time. So it completely depends on the individual as well, but for those who it is a challenging diet, and we just try to be a resource for, increasing compliance on the diet. So the more information and the more options we give to families, the better chance they'll be able to.
Do you have like a website or something with different recipes that you?
You can go to the Children's Hospital website, and just search CHOP keto recipes, and we have some recipes on there.
Like password or anything to.
No. And we're always working on new ones for that we communicate sometimes within our program and our patients, but we do have a website with a lot of recipes and photos. Sorry? Something like that, about 100 recipes or so.
Yeah, because it's helpful at some point, because everything works while it works, and then you have to try new things.
Right.
And as Sarah said, like no child has the same meal plan, so we always just say you can't necessarily follow a recipe. There is no one-size-fits-all recipe, which is another reason why my job is challenging, which I love, but it's also like one child might have 1.5 times the amount of protein in their meal plan than another child. So if I have a recipe that has some chicken in it or salmon in it, every recipe has to be adjusted. Every amount has to be adjusted to fit in with that child's exact meal plan. So we do recommend doing it like under the guidance of a doctor or a dietitian. It's complicated, but yes, just for inspiration, of course, and ideas, we have a lot of recipes up there. You're welcome.
Thank you.
Okay, thank you very much.
Your time.